My name is Kayla Parker Tolbert. I've been married for 2 years. I am a songwriter. I am a vocal producer, and I've been doing that for about 15 years.
My dad is 84 now. He's going to be 85 next June. All his life he works as a TV and radio producer. He have a program in a radio station over there in El Salvador every Saturday.
My name is Lorinda. I'm 35 years old. My husband and I have been married for 4 years, and we have recently enjoyed the new addition of our little baby boy, Thomas, who is 12 weeks old.
$1999, I was diagnosed with cancer, with breast cancer. And I couldn't believe it. I was totally blown away because here I am, traveling and doing my thing. And I never thought that this would be my situation in life.
July 2004, he started feeling very, very sick. So my mom and my brother took him to the doctor and discovered he had a cancer in his stomach.
My husband and I had hoped for a baby for some time. In July of last year, 2005, we found out the wonderful news that we had finally been blessed with a pregnancy. And then a few months after that, and in October again, we were given the news that I was diagnosed with liver cancer.
I went through the conventional medicine, the chemotherapy. I had a lot of reactions to that. A stem cell transplant and also radiation. It came back 2 years later with a vengeance, and it had moved to the liver, the lung, the spine, and the skull. And after having the second surgery for that breast cancer, they gave me 6 months to live. Immediately, actually, they wanted to radiate me without even really knowing exactly what the problem was, and that scared me because I'm like, can we, talk about what it is? So they wanted to do radiation and chemotherapy. They told me the radiation would leave me with dementia, and the chemotherapy basically would keep me here for a while, but I would be sickly, and and I didn't want to go out like that.
They recommend surgery, but they don't guarantee that he's gonna survive. They give my dad only 8 weeks.
I was under the advice of a few doctors, and each of them suggested that the pregnancy would not work, that I terminate the pregnancy. They also then advised that I go with chemotherapy and radiation in the interest of prolonging my life by hopefully a few months. Of course, I felt doubly vulnerable because of my pregnancy. I felt extra responsibility. It wasn't just about me, it was about my baby as well. We had a lot to think about, but I did not feel comfortable with what the doctors recommended. We firmly felt that God had given us this baby, and that was His and His alone to take.
Let me tell you the truth. Everybody was skeptical, We don't complete believe on this, but we had to take the chance.
My brother was a light in the darkness, if you will. He said that, we're going to beat this thing. We're going to go to El Salvador at this point. And I said, where? What?
I was a little afraid to go to El Salvador, didn't know what to expect.
With the risk of sounding ignorant, I wasn't even sure where exactly it was on the map. And based on things I'd seen, which is limited knowledge, but I'd seen on the news, I said, do I need a bodyguard? Is it safe?
I figured that if cancer hadn't killed me, El Salvador, wouldn't hurt.
Well, I realized I was very wrong. It was a very modernized city. It took me aback that their shopping malls rivaled ours. The people were very kind. The accommodations were wonderful.
I was walking the hills of El Salvador, enjoying the weather. We felt like we were on a vacation, actually. We forgot why we were really there. we were greeted by Dr. Bertachini and Dr. Rejas. Love Dr. Rejas and Dr. Bertachini.
My mother had cancer of the liver, but I did not treat her with any of the traditional or commonly used treatments because I refused to see her suffer. Well, it was at this moment, the moment that I started to become aware of what the needs of the patient truly were, that I took on the study of different methodologies for the treatment of cancer.
He smiles all the time. If he has a bad day, you won't know it because he's smiling.
Dr. Bertachini was so kind and so compassionate. He just lit up the room when he walked in, made me feel very comfortable. He just exuded a professionalism that also made me feel very comfortable.
I realized that not everything can be cured with a scalpel or with a drug or with radiotherapy, and that there are other hidden factors that had to be taken into account.
I felt like I was a person and not a number. When you go to hospitals, sometimes you feel like, you're just a number. They're talking at you and not to you. And he was talking to me.
He talked to everybody in the family, not only with the patient, not only with my dad, but also with my mom, with my sister, with myself. He treated my dad as a human being, as a complete human being.
Actually, I believe I cried before I left because I didn't want to come back to the U.S. and deal with feeling like I was a number again.
My greatest satisfaction was to see how my mother's life was prolonged. I reproduced that very important experience in every one of my patients, to create a loving bond with them, to have a one-on-one relationship. In that bond, that loving relationship, is where the true art of medicine lies.
I feel like, to be honest with you, that nothing is wrong with me. Once again, they gave me 6 months to live. Here I am 3 years later.
I mean, everything changed, not only my dad's health, but also the situation in my family, and the whole family changed.
I had wonderful response to the treatment and normalcy with the pregnancy. Obviously, I grew and delivered a healthy baby and am doing wonderfully. It simplified things very much when I put it in this perspective for myself, and actually my friend did so for me. But is this the time when you need your immune system, or is this the time when you should wipe it out with the traditional treatments? In my perspective, it was the time to wake my body up and to tell those cells, the good cells, my friendly cells, that it's time for you to go in and fight, and this immune system needs to be empowered. And so I would suggest that before you make any decision, to step back and ask that question of your body. Do you want to increase your immune system, or do you want to wipe it out?
I believe that the body is designed to heal itself. You just have to put the right things into your immune system in order for it to kick back and start the fight. And that's basically what I believe this treatment is about, is boosting your immune system so that you can heal.
This is a miracle. It's a miracle because it not only work as a medication, as a medical treatment, but also work as treatment for the human beings, for the total of the human being is. Not only a person that is sick, but a person who get emotion and feelings, and the whole human beings as a unity.
Come to El Salvador. You'll have a whole new family, you'll have a better quality of life, and you'll learn stress is a part of disease. There's so many things you'll learn. You'll feel better, but you'll learn a lot of things, and then you'll meet a great family like me.